wouldn't get like blood everywhere. I had it down. I had the system. And then all of a sudden, I'm just seeing blood like on the patient's blanket. And I'm like, dude, I closed this. There's no fucking way I closed this IV. Like, where is this blood coming from? And then the patient looks at me like this, mortified. And this was pre-pandemic 2018, and I would wear a mask because I was pregnant. Like, you don't know what's coming in. During my pregnancy, I was exposed to measles, I was exposed to TB. So anyway, I had the mask on my face and the blood was gushing through. I hadn't felt it or tasted it, or I don't know what the hell. I was so focused on starting this patient's IV and getting him connected to the monitor that I guess I didn't realize that I was bleeding through my mask, and it was gushing and it was dripping on the patient. Guess who got written up for that? Me. I got written up for that because they had to run extra labs on that patient because my blood ended up in his bed. Yeah, I got written up for endangering a patient because I bled on him. The hospital I work at also penalizes you every time you call out. Only allowed 5 call outs a year. Oh, wow. Yeah, so what I mean is, do I want to do I want to work in a hospital? No. Do I miss my patients and the adrenaline, that camaraderie, that feeling of being in the emergency room? Absolutely. Actually, insane. My doctor also worked a whole pregnancy. It was so sad to see she was the only doc. Um, I mean, women are resilient. We are fucking rock stars. Like, it's just, we can do anything. We can do anything. It's not that, oh, I'm pregnant, I need to be at home. Blah. Like, I didn't give a shit about that. I loved going to work. That wasn't the problem. It was the fact that I, like, probably one of, we had many disgusting things. Obviously, it's the emergency room. You're going to get like homeless people with bugs inside of their legs, lice, bed bugs, everything and anything. Um, so I wasn't disgusted about much. It's just, it was like I don't know, maybe I was like second trimester, so where things are supposed to start normalizing. And I had a patient come in from a nursing home with delirium. And usually, if it's a female patient and they have delirium, it's an untreated UTI. So I needed to cath her. When I tell you, when I inserted that catheter, and the amount of yeast that came out of this woman hit my nose from the mask, I started puking in my mask. And in that moment, my charge nurse walked by and I was like, Christian, Christian. And he ran in. I was like, please take over. Please take over. But he couldn't. He didn't have sterile gloves. So anyway, I finished it up and I was like, just like, tie the fucking tape to her thigh. Like, I ran out and yeah, well, there it was. I went for an injection for my face. He didn't do it because of my age, saying my cheekbones are so small. Okay. Can you kindly please tell me what PRX is? I'm very curious. Had a whole garlic up her hoo-ha to cure her yeast infection. Garlic? That's a first. You can put yogurt. I've seen like live cultures will help. How the fuck does that work though? That's for UTIs, not yeast infections. Is what possible? Oh, the cheekbone thing? I'm not sure. Um I'm really not sure. I wouldn't be able to tell you without seeing your face. What do you think of sculpture for smile? Sculpture is not indicated for smile lines. Please do not do sculpture for smile lines. Um, sculpture is, you guys, sculpture is a slow grower. We call sculpture the fertilizer of our industry. So think about when you're taking care of a lawn, right? You put the fertilizer and you wait for it to grow. That's what sculpture does. It is made up of PLLA, polyl-lactic acid, and this is considered to be a biostimulant. And this is a great segue to what PRX is, because sculpture is an injectable biostimulant, and it is considered a biostimulant because it activates your fibroblast activity, creating collagen. So the problem with sculpture induced collagen is it's creating collagen type 3, which is scar tissue. The ideal type of collagen we want is collagen type 1. So this is why plastic surgeons don't like sculpture. I absolutely love it. I think it's beautiful. I've done 3 vials in my face. I had plastic surgery in my face. I had a facelift. So I know for a fact that it is not problematic, and your surgeon should be able to work with it. So sculpture is good for people who have like these kind of perioral rhytids. So these folds, these wrinkles. A lot of Caucasian women have them. Like just from smiling, the skin is crepey. The skin is very crepey. It's not taut. So if you grab their face, it doesn't pull like this. Like it's not full of fat. So there's not a good amount of fat in there, because if there's one place where you want fat, it's in your face. So sculpture is really good for that. And I'm very selective about who I do sculpture on and what their expectations are, because a lot of people have completely wrong expectations of sculpture, what sculpture can and cannot do. And that's why it gets such a bad rap. But also, again, it is a slow grower. You're doing 1 to 2 vials per session, and you are doing the number of vials depending on your decade of life. So if you're in your 30s, you need to do 3 vials of sculpture. You're in your 40s, you do 4 vials of sculpture. So that's just how we look at it. But again, these are your biostimulatory mechanisms. So the PRX is considered a topical biostimulant, meaning that we put the solution on your skin and then we massage it with 3 to 5 pounds of pressure down to the mid-papillary dermis. Now, the mid-papillary dermis is where the magic happens with fibroblast activity. So the fibroblast activity is what we want when we're producing collagen, elastin, hyaluronic acid. So it's 33% TCA, kojic acid, and hydrogen peroxide. The hydrogen peroxide is the proprietary method in the PRX. That is the driver. It allows your PRX, your 30% TCA and kojic acid, to drive down to the mid-papillary dermis, which is where that fibroblast activity is happening at its peak. And now you're stimulating that growth. So that collagen growth. And it is your no pain, no downtime, pretty much very affordable. We charge $1,600 for a series of 4, once a week for 4 weeks. And you're seeing visible changes in your skin, like your skin glows. Like this makeup that I have on, it looks the way that it does, not because of the fucking makeup I'm using, even though I tell people it's the makeup. It's the skin. Makeup only looks good on healthy skin. Who is she talking to? Not your dumbass, Dee Dee. I don't have any filler in my face. Dr. Faryan Jalalabadi did my neck and facelift. I was 35 years old, Jazz. Thank you, Zahra. So this is like a really important topic to discuss when it comes to aesthetics and things that people and the expectations that people have. I work in aesthetics every single day. I own a clinic, I own a practice, I train people on aesthetics, I train people on injectables. I don't have a single ounce of filler in my face, but I had a facelift at the age of 35. Why? Because my physical presentations were different and required a different type of treatment. So when I see a 35-year-old whose skin is sagging, what the fuck am I going to do to you that is going to make you feel like the money that you're going to be spending is worth it? Nothing. How long does PRX last? Up to 9 months. You really are pretty. Never would have guessed you had a facelift. That's the point. You should never be able to tell. You should never be able to tell what anyone's had done. So the very, very common misconception of like plastic surgery. I don't use any radius. Radius is outdated technology. Um, Sculptra for particular candidates only. Which doctor? Dr. Farian Jalalabadi. Which procedure do you think transformed your skin the most? I really can't pinpoint it. I do them all. I do a CO2 fusion laser. I do topical PRX. I do chemical peels with my Botox. I do an erbium laser. I do a CO2 laser. I used to do Morpheus. I don't do it anymore for skin resurfacing because there's nothing left to resurface.